Hello, my name is Dr. Ospina, and this is one of our favorite patients, Jason. We're here, I guess, almost finishing the main portion of what we call a full mouth reconstruction. Just a couple of questions that I want to ask you, because you're a pretty unique case. Can you explain where you were before we met?
What, as far as my teeth?
Yeah, as far as your teeth, yeah.
So I mean, I've always had healthy teeth when I was younger, but I tend to grind real bad. So, not missing but one tooth that I had pulled years and years ago. I had a full set of teeth, but I just grinded them all the way down to where they were becoming almost, uncomfortable. And also, to me, they were, something I wasn't kind of ashamed of to smile. They just got uneven and they were smaller than normal. So that's basically where I was. I had the one tooth missing, and some other teeth started to have some decay in the very, very far back from a cavity. And then other than that, it was just a grinding issue.
And you had you looked for a lot of opinions, right?
Oh yeah. I went around several different
Walk
doctors.
us through that journey. What was it like?
Well, I was bouncing back and forth, of course, just talking to people and going to different dental appointments for cleanings and stuff, and getting, different recommendations on both doing full crowns or ripping everything out and doing the implants. Most of the time was the all-in-4 that I was, pushed towards as far as the implants. I mean, I researched stuff in Colombia, Costa Rica, and here in America.
Mexico,
prices.
Mexico also?
Yeah, just different prices and different scenarios and different opinions and everything on it. So.
And how many years were you pondering about, when and how to do this?
Well, it became more stronger the past 4 years, but prior to that, probably, maybe 4 or 5 years prior to that, I think I went back to a old dentist when I was going and getting all these different evaluations done, and they had actual dental pictures from 2000, it was either 14 or 19 back, and they compared how bad my wear was between then and now. And I think I have pictures on my phone of the two from the before and after. So, and I even asked them, and they said basically they pointed me in the same direction as you, and that's why I kept seeking. They said the root system and everything of my mouth was too good for her to want to rip everything out and put implants in there. Right. That's basically the same thing you told me. So that just kind of pushed me more towards your advice and doing the crowns and keeping everything that I have and just repairing it instead of ripping everything out and going through a whole entire different mouth, I guess basically it would be.
Yeah. I'm very proud of you for going through with that. I get very emotional when I finish a case like this, because it's such a big decision, Why would you pick Designer Smiles, Dr. Ospina's team, versus say Colombia, which is supposed to be kind of cheaper, and other countries? Why did you decide with Designer Smiles?
Keeping it local, the one reason was basically just if I had any kind of issues, like I've had some issues, then what I got to do? I got to go back to originally to that country where I got it done for them to know what's going on, or be able to guarantee anything, or know, everything, all the work that they did to be able to fix anything that I have issues with, as easy as trying to find somebody here to fix somebody else's work. And then doing the local, all the different local versus, when I came to you sat down and just kind of put everything out on the table for me, explain everything in detail, made me feel real home, comfortable. It's all about the comfortability. It's like same with my line of work, it's building relationships with people and letting them know that, you know what you're doing, and, we got you, basically. And that's how I kind of felt with you, and felt more comfortable. The price is different. You guys were able to find an insurance for me, doing the crowns versus the implants. Also, you can get insurance with the crowns, and you can't get usually the coverage with the implants. So that was another thing. It helped me with the finance level and kind of keep me where I wanted to be, with everything.
And you were right about deciding to stay local, because we've had adjustments. You know, it's not just putting these things on and then everything's smack on.
I couldn't even tell you how many visits we've
Yeah,
had since
afterwards.
since the start. You know, and I would
quick,
have
quick
felt
visits, but you know,
I would have felt uncomfortable going to another country and them just rushing and doing something and say come back one more time. You know, what about all the adjustments in between and you know getting everything right? It would have just might have turned into a mess.
yeah. Can you go through briefly the process of actually doing the work? How many appointments and I guess the process itself.
Well, yeah, if I can recall with
Was
everything
it
else.
fast? Did it take long? Or how was
No,
it?
I mean once we made the decision, you know, came in. Of course, we did the root canals. I think we did about 3 root canals, and then basically you prepped went in. That's when you put me under, prepped everything. I had gum surgery because I had a lot of I guess the gingivitis or gum disease.
Yeah.
So you repaired. That was probably the hardest part or the most painful part.
Right.
Was the gum issue. Once you did that, then we got the temporaries put in all in that day. So basically, I walked out of there with a different smile, even though it was temporary. Still looked good. I was already getting compliments on that. And then after that, then we basically kind of made appointments in between to make sure everything's clean, teaching me, you know, how to get everything clean, teaching me all the flossing, the brushing, and everything like that. The different care,
pretty different, right?
the different eating habits,
yeah.
you know, just everything, you know, to make. So this will be the only time. Hopefully, I can have to replace them. I don't have to keep doing it every.
And how do you feel now? Like today was an appointment where we came in. We delivered about a month ago, kind of, right?
Yeah, I believe it's been about.
And we didn't deliver your occlusal guard, which is, you know, what needs to be worn by somebody that has, you know, that severe
Grinding,
grinded that you have. We broke one crown.
Mm-hmm.
We broke a zirconia crown, which is supposed to be like this, one of the strongest materials. So that gives us an idea of how powerful your bite is. Okay, but overall, you know, how are you feeling now that you did what you did, and would you recommend somebody to do this?
Comfortability, I feel a lot. I'm still healing, but I mean it's, you know, nothing like it was before. So I mean I feel a lot better, and of course comfortability with myself. You know, being able to smile and not, you know, closed mouth smile every time, and talk to people with more. I guess it gives you more confidence and stuff. So I feel great. I feel good about it.
Well, again, I'm very proud of you. And I want to thank you for trusting us with your health.
Yeah, and I definitely would recommend people, and I appreciate all y'all's work. And you know, it's just, even when I've had issues on the weekends and even 9 o'clock at night, I'll shoot a message and y'all get back to me and we'll have you in tomorrow. Emergency. You know, I had a crown fall, a temporary fall out, that bridge.
Yeah.
And the next day I was in there by noon. You guys had somebody come in on their off day and take care of it, and that's stuff like that's wonderful.
What is the next phase for us? Now that we did 95% of the mouth.
Well, yeah, we crowned everything, and I have a temporary bridge for the one tooth that I did have missing, the molar in the back, which we're going to go in and do the implant, which you got to do some bone grafting and put the permanent implant in, which you said that's about a 6-month process.
Yeah, because right now, I guess what we did is stabilized any gum disease, any infections that you might have had. Now, basically, we're in a clean slate.
Yeah.
And surgery always goes better when we're, you know, in a clean state. So.
Yeah, I mean, like today's appointment, you said I'm not going to give you any numbing, and I was kind of like, oh, all right, am I going to go through pain today? And it didn't bother me one bit. It was good. Everything went smooth. So
you have changed too. I'm telling you that from the first time we met.
Yeah.
You were pretty apprehensive in the chair, and now you were just.
I don't think anybody likes dental work. That's like dental is like the most painful thing to go through. I mean, it's like straight to your brain. So.
Well, as a person who lives off of smiles, I want you to know that you have a beautiful smile.
Yeah, thank you.
And you need to sport it now.
Yeah.
Just sport it all the time.
For sure. Yeah, I've been hearing that. I appreciate you.
Thank you, sir.
Thank you.
Okay.